Hello. Yes. I have a 5-month-old baby.
Hi. My question goes to the physician.
What is the dentist advice on the way forward?
I wanted to know what are some of the treatment options for cervical cancer.
Very good afternoon to you. You're right on time for this week's edition of Doctors on Call, and the due date is finally here with us. And today our focus shifts a bit as we focus on depression. And many of you are asking, now, why depression? Simply because this week we are celebrating World Health Day, and this is an event marked to commemorate the founding of World Health Organization. And the focus for this year was depression, with the theme Let Us Talk. So the entire show for this particular episode is on depression. I have two amazing guests with me right here in the studio. They're just going to introduce themselves, and of course I'll start with a fair lady. Good afternoon, Daktari.
Good afternoon to you.
How are you doing?
I'm well, thanks.
Jitambulishe.
I'm Dr. Catherine Mutisia. I'm psychiatrist. Okay. I'm a psychiatrist.
Psychiatrist.
Yes.
Just that.
Yes.
The lady of a few words. Nice to have you back again on the show.
Nice to be here.
All right. Dr. Mutisia is not alone. I have a gentleman here with me, the guy in the black coat. You are making me look odd.
Oh, that's nice.
Welcome to the show.
Sure.
Yeah, a brief introduction on yourself. So.
Oh, yeah, sure.
Yeah.
I'm known as Peter Clinton. Mm-hmm. Peter Clinton is a clinical psychologist. Yes, working in a mental institution.
Peter Clinton.
Yeah.
We majina zako zote ulisema tu zitakuwa za huko. Nice to have you on the show. Karibu sana.
Asante sana.
And also I want to invite you, as this show is all about you. Talk to us on 22316 and also WhatsApp 0786316316. Remember, the theme is depression. Let us talk. If you have any questions whatsoever revolving around depression, please, I have a competent team right here who are going to sensitize us on why should we talk exactly about depression. We are coming to you live on Family TV and also Family Radio 316. We are also streaming on our Facebook page, Family TV. In fact, I can see myself. Yeah, there we are. So if you have somebody who's not yet home, you can tell them to just go to our Facebook page and type Family TV, and they can be able to watch the show on that. How cool is that? Now, getting right onto it, when we're talking about depression, I'll start with you, Dr. Mutisia. What exactly is this? Because it's not in one circumstance. You're always hearing people of, Aki, I'm depressed. Do we loosely use this word? Do we even know the meaning of the word depression, Dr. Mutisia?
Thank you very much.
Yeah.
Depression is actually a mental disorder whereby a person feels sad most of the time, and they lose interest in things they previously enjoyed doing, like somebody who loved going to work. All of a sudden they don't feel like going to work, and it might be accompanied by other physical symptoms like loss of appetite, feeling lethargic. And for us to actually make it qualify to be clinical depression needing treatment, it has to go on for like 2 weeks. But I know loosely people will say I'm depressed when they mean maybe they are not happy. Yes.
And Peter, let me also bring you in on this. Sure. Do we say then where does stress come in? So is stress the one leading into depression, or stress is just a different condition on its own?
Well, there are two different variables. Yeah, stress and depression are two different variables. Yeah. So you can there are two different variables, but under one umbrella. And the umbrella they share is that both are actually having the psychological bit of it is there. So you get somebody who is stressed up, that is also psychologically derailed. Somebody is actually psychologically
use English away. Please, I got lost there.
Yes.
Yeah. Simple language, because the thinking that I have is, if you have stress and it piles up, eventually it will lead you into depression. Is this not the case?
Definitely.
Yeah.
And that's why I look at them as two different variables, but then they share a common thing. The common thing that they share is that psychological bit of it is there. And that's why you'll see, like, you people talk about stress, and then if they fail to handle it, then it piles up and then it can lead to depression.
All right.
Absolutely.
And what is the prevalence? Because I know you have all the statistics. Then why should we be talking about depression? Is it because the prevalence, the numbers are rising up, Dr. Mutisia?
Yeah, depression is quite common.
Yeah.
And we know that it is actually the leading, while in the world it's a leading cause of disability. When I talk of disability, I mean when people are depressed, they will not reach their potential. They'll not be able to work, take care of their families, relate well with people. So it's a leading cause of disability. It affects everybody across the age groups from childhood to old age, and it cuts across races, it cuts across social classes. So in Kenya, we know that 10% of our population is suffering from depression or with anxiety, because they commonly occur, and anxiety disorder is where somebody worries about various aspects of life with various forms of anxiety, maybe panic attacks or social phobia or generalized anxiety. So quite common, and we know that studies which have been done locally, that people who are attending general outpatient clinics, about 42% of them have depression, and the sad thing is only about 4% would be correctly diagnosed, meaning that you could go to hospital thinking you have headache, but it's pile stress leading to depression, and most of the time it's not correctly diagnosed. Yes.
And Peter, when we are talking about depression, because we want everybody to relate to this show, so what are these factors that can contribute or propel you into falling into depression? Yeah.
Well, when you talk about factors that can propel someone into depression, there are many.
Yeah.
There are many factors. Life events. That is maybe like there's something that you are targeting to achieve, and then you fail to achieve it, and then the moment you fail to achieve it, then the general wellness, everything changes. Your perception of your perception of it changes, and then actually it takes you into that period of low mood where you are regretting, I've lost it and I'm not going to catch up with it again. That is on the other side of life events. Now we also have issues to do with family dynamics. There are challenges that people also face in families. So all this can also take one into depression. Now, tasks, like you have something ahead of you that you want to accomplish, and then you fail to accomplish it, then it also changes the perception, and then it can also take you into depression.
Then how do you deal? Because I can easily classify all these factors into two: things which you have control over and those that are above you.
Absolutely.
So for things that you have the control, it's easy, you can always sort them out, get help here and there. But for the things that are above your reach, how do you tackle this particular classification, Peter?
That is it. Now that is actually the challenge. That is actually the challenge, and that is what makes people vulnerable at the end of the day. Actually, it leads to what you call overgeneralization, where like you want to tackle the ones that you cannot tackle, and you mix it up. So when you mix it up and then you find yourself challenged, like you cannot be able to achieve it, then it actually leads to that bit of low self-esteem, and depression comes in at the end of the day.
All right. Then how do you know you are depressed? That's a question that we're going to be asking in a short while. But remember, this is Doctors on Call, of course, coming to you live on Family TV and Family Radio. Not forgetting the streaming option, which is Family TV. That's on our Facebook page. Continue talking to us on 22316 and on WhatsApp 0786 316 316. I've received a question from Justin from Kikuyu, which I'll be asking in a short while. But Dr. Mutisia, I saw something that really caught my eye. It says that when it comes to depression, actually women are more affected than men. Why is this the case?
Okay. Yeah, we know that it's true that women are affected more by depression as compared to men. And we know partly some forms of depression, like postpartum depression, which will affect women only because they come after childbirth. We know that there is a premenstrual dysphoria, which will also, the one related to the monthly periods. It will also affect women. But we know generally that the society, there are many more stresses related to gender for women because women have to balance many things. So there is the psychological aspect. There is also the genetic and the biological and the hormonal component. And we know in Kenya that the statistics show like almost double women, about double the number of women affected by depression compared to the number of men affected to depression. Yes.
Something that maybe I think it's also important to point out, you've mentioned postpartum depression. Does it mean that when it comes to depression, it's not just one word, but we have different types of depressions when we're talking about this condition?
Yes, there are various types.
Yeah.
Beginning with, there are people who suffer from what we call unipolar depression. So they will never, their mood will be high, will be low, and they will never suffer from what we call a manic episode, which is basically high energy, very happy, very excited, overspending, loss of inhibitions, lack of sleep, and still feeling energetic. So one can be diagnosed with unipolar depression, which we commonly call depression, but somebody can also have bipolar depression, where if not treated, it alternates with a manic episode. But again, we also have other forms of depression, like the postpartum depression, which will come after childbirth in women, premenstrual dysphoria, I said, again affects women. Yeah. So basically, there are various forms
of
yes.
So now, picking up the question from Justin Peter, maybe you can take this up. And we all know, more so when it comes to mental health, there are so many stereotypes, there are so many myths, there are so many misconceptions, and this is one platform that we use to try and set the record straight. And Justin is asking, plain and simple, can depression cause madness?
Indeed, depression can cause madness.
Yeah.
And that's why that awareness part of it is very important, so that one need actually to understand his mental state, so that we don't actually succumb into that umbrella of madness. When you fail to handle depression, then it actually leads to that state where now you lose touch with yourself. The moment you lose touch with yourself, then that is when now madness is being welcomed. And yes.
And of course, maybe that's the point where we start abusing things, and we are going to be talking a bit more on that, something like alcohol later on in the show. But I'm seeing a comment on our Facebook page from Liz George. Hey George, I'm getting you clearly from Kabete Doctors on Call. Thank you so much, Liz, for tuning in. Dr. Mtisi, it takes me back. Then earlier on, of course, Peter mentioned the bit on factors that can lead to you getting depression. But as an individual, how do you know you are depressed? What are some of the signs and symptoms that if you see, you know there is trouble and I need to get help when depression is concerned?
Basically, when depression is setting in, one can be able to realize that they feel more sad than usual. They lack interest in things they enjoyed before. They feel lethargic. They don't feel like they have energy. They are not excited to move on with life. They might discover that their appetite is low, their libido is low, and in severe cases, one could even start having suicidal thoughts. So depending on the severity, when somebody is very sick, what we call psychotic depression, probably that is what people would call now madness. It is so severe that the person can't even eat, can't talk, and they don't realize they are sick. So basically, initially, when you start when you discover your behavior and how you feel is changed, then it's always good to seek consultation to find out what exactly is the problem. Yes.
Then do you have stages when it comes to depression whereby it keeps on escalating, whether it's mild or serious?
Yeah, we can have mild, moderate, and severe. And mild, you might not even need medication. Probably you need talk therapy, where you would be able to, you'll be assisted on how to deal with the thoughts, your thoughts, and how to adjust your life, how to deal with daily stressors. Moderate would require psychotherapy in addition to medication, and severe ones are the ones which are suicidal. We say when somebody is has suicidal thoughts, it's actually a psychiatric emergency. They need admission. Those are cases which might even need the severe forms of treatment like electroconvulsive therapy. Yes.
We're going to be also talking about treatment in a bit, but I can tell you for a fact that there's a fan of yours on Facebook, Irene Muya. She says, I always like advice from Dr. Mutisia. Thank you so much, Irene, for your comment. Remember, you can still talk to us on 22316 or WhatsApp 0786316 I'm seeing so much feedback coming from our end. Today, actually, I have double gadgets. I have a phone here with me and I have the laptop, and the purpose of all these things is to air some of your questions that are coming from you. That's why I'm always busy in between these things. But also I want us to address something in particular, the teenagers and the youth, because over the recent past, not so long ago, you've been hearing cases of Dr. Mutisia mentioned suicide. I know it gets to that point. But for the teenagers, how do you deal with the depression? Because, there's a case that was there in the news like a fortnight ago, whereby a teenage girl just decided to end her life. She just left behind a note, which wasn't quite explaining what the issue was, but she was telling her family not to be sad, she's in a better place, and what have you. So when teenagers are involved as a parent, how will you tell that there's a problem with my child and I need to take her or him to the hospital, Peter?
What is important actually with depression, just as Dr. Mutisia is giving it out, what is important with depression is all about, I'll actually repeat it, understanding your mental state.
You're dealing with a teenager here.
Absolutely. Yeah, with a teenager, there's this common thing, we call it anhedonia, like losing interest with the common things that you used to do, isolating, not wanting to, with a teenager, maybe let's talk about going to school. So this is a youth who is actually closed. He doesn't want to do A, B, C, D. And he's actually not really in a mood to talk to someone, So that is what now we normally tell parents, that when you realize that there's something, there's a problem, there's a change in your young one, then what you need to do is all about assessment. You take him to a doctor for assessment, because the time comes that if you don't handle it, then the suicide part of it comes in. And that's why you see it's common. A youth suffering inside, he lacks the inner peace. And then the moment you lose that inner peace, then what comes into your mind, they normally resort to those irrational, those illogical beliefs that they are very comfortable. And that is why now the issue of suicide is coming in. They convince themselves, even in that world of suicide, that everything is okay, even if they stop their life at that time. So what is important is all about losing interest with the common things, the normal things that you used to do, and then isolating. You don't want to talk to people. There's this bit of lack of sleep. Some people normally suffer insomnia. Some also resort to oversleeping, where now the sleeping patterns changes. So there are those common things: losing interest with the things that you used to do, or lack of sleep, lack of appetite. Easily angered. Those are, absolutely. Those are things those are the common signs that can tell a parent that something is not right somewhere. So with the moment you get that signal, then the next thing that you need to do is just maybe shout for help.
Dr. Mutisia, I also want to get your thoughts, being that when you're dealing with teenagers, right about adolescence, there normally is a lot of changes. So how do you distinguish? As Peter clearly stated it, they lose interest. But also, during this time, they try and act mature. In that, if they were doing something, let's say if they were bubbly, all of a sudden they are reserved, they are introverts. So how do you tell the changes that come about with, crossing the lines of adolescence and what have you, and depression, that this is, she's growing up and this something is wrong, there's a red flag?
You're right, it's usually a difficult time because there is the usual changes which come in. But now when you're talking of depression, adolescents might present with a lot of extreme irritability. in extreme withdrawal. And lack of interest, because again we know adolescence is when they are developing interest in careers, interest in sports, interest in makeup, like for girls. So again, you would discover that this is normal when you compare with other teenagers of their age. And this is a time also they can experiment with alcohol and other drugs to numb themselves. So you need to actually be keen to not either change of behavior. They could start self-medicating with the alcohol and other substances, or it could be present as disruptive behavior where they have hunger outbursts, they fight a lot, and you have to be keen. And the best thing would be, once you realize that change of behavior, that you take them for assessment. Yes.
And self-esteem, because most of these cases you find that it's pegged on self-esteem. So how do you approach this? Is also to the girls, am I beautiful enough? I don't have these clothes. Because with them, at that age, it's normally material things. How do you handle such a scenario? Where self-esteem is also concerned.
Basically, when you're talking of depression, we say that the thoughts of the person get distorted. For example, they will look at life in categories. I'm either an A student or I'm a failure. So somebody getting a B or a C, they'll think I'm a failure. They will generalize and say, because I encounter this problem, then I will always encounter this problem. They have a lot of should statements, like, life, for me to be happy, life must be this way. So you have somebody with thoughts which are not usual, which are distorted. So part of the therapy includes then helping them deal with those thoughts, realize that they are not the true thoughts, and help them turn around their thoughts to be able to have thoughts which will support their health and support their reaching their potential.
So when it comes to Peter, the actual diagnosis now, who do I go to? How is it even conducted in the first place? Where do I get help?
For
the diagnosis purposes, you've established there is a problem, and you really want to get help. But mark you, there's also the aspect of stigmatization.
Absolutely.
In that you are afraid to go to a psychologist or psychiatrist because people will see that I'm mad. How do you approach that?
Absolutely. That is actually what has made depression to worsen in our country. And that's why now you can see the cases of suicide are common. What is important here is all about the moment one realizes that he has a problem, then the key thing is all about meeting or visiting a doctor, a nearest doctor. And in this case, actually a psychiatrist can really work. So what is important is all about meeting or taking this patient to a specialist that can be able to handle this case. So what is important all about awareness, so that they can understand. You see, now the issue of mental health, it's still very low in our country. And the moment you talk about going to a psychiatrist or going to a clinical psychologist, then they see you like you are going nuts.
Uko na kasoro
mahali. So what is important here, just like they put it, that there's no health without mental health. So what is important here is all about screening. The moment this patient is screened, then a psychiatrist can be able to give the right, or can be able to give a good platform for his recovery.
And also important to know that it's always good to exclude other causes of depression, which can general medical condition. For example, somebody with a problem with thyroid could present with depression, some cancers, some brain tumors. So it's always good to have tests to exclude other general medical conditions before we make the diagnosis of depression. Yes.
Speaking of other conditions, I have here Ndeda from Kisumu on 22316. Ndeda says, I'm always, earlier on, I know we talked about symptoms of depression, but he has a specific condition. So let me just ask this question based on that condition. He says, I'm always fearful, angry, worrisome, pitiful, encounter bad dreams at night, and at times I don't want to hear bad news, and particularly death news. Are these the symptoms of depression? I'm 58 and I suffer from a heart disease. Yes. So, what will you say about Ndedas?
Yeah, heart
They-
diseases are commonly associated with depression, and it would be very good for that person to be evaluated, because again, some medications which are used in treating of hypertension or some heart conditions can also contribute to depression. So it's very important for the person to be evaluated to find out, is it the heart condition which is contributing to this? Is it the drugs? And if even if it's the heart condition, then the depression would still need treatment. So it would be very good for them to visit a doctor.
But
for
maybe you just clarify what's the correlation between maybe some of these diseases and depression. Let's say heart disease. What's the correlation between the two?
the fact that they are chronic in nature.
Okay.
Some diseases like diabetes, hypertension, heart diseases are chronic in nature.
Yeah.
You're talking of somebody who has to be on medication daily, who has to change their lifestyle. So the fact that this is an illness, you live with it for a while, can actually make you depressed. And like I said, some of the medications can also contribute to lowering the mood. So it's a combination of many factors. And again, we know high stress level and certain personalities can also predispose one to getting both the heart disease and also the depression. Yeah, because uncontrolled stress over a long time has been shown to actually precipitate heart diseases and also precipitate depression. Yes.
Depression. Thank you so much for that particular response. I have a question here, and actually it was also coming from Deda, and I've also seen one on WhatsApp. And just a reminder, our WhatsApp number is 0786316316 regarding treatment. And also the second bit in Deda's question was asking if depression can be completely treated. We can talk about the treatment options, starting with you, Peter.
Yeah, depression can be treated completely, but then there's this bit of it where a depressed patient, when he's actually diagnosed and found with depression, and then the moment they start treatment, there's this part of it, we call it the relapse. But then the relapse only comes in when he's actually not adhered to the drugs that he's actually been prescribed. So what is important here is all about the screening of the patient. And in this case, a patient actually can be screened by a psychiatrist. And then the moment he's actually screened, then the patient can be channeled for these antidepressants. So in the context of the antidepressants that there is actually being projected to, there's also this bit of psychotherapy that this patient also need to be taken through. The psychiatrists will actually assess the patient and then give him a platform on how he's actually going to move on with this drugs, the antidepressants. And then this patient will actually be projected to either clinical psychologist or a psychologist, so that this person now will help him, curb those underlying issues that actually led to his state of depression, because it's all about psychological. And then when they pile up, and then that is when they cause the depression. So the psychiatric part of it, and then the psychotherapy part of it. So you can, if you adhere to those antidepressants, and then you also follow those therapy sessions that you're being projected to by a clinical psychologist or a therapist, then one is likely to go back to his normal wellness. Yeah, so one can resume to his activities, and it can actually conclude that issue of depression in you. But what is important is all about, are you aware of the underlying issues that actually led to your depression? Yeah.
Dr. Mutisi, I'm going to come to you in a bit regarding antidepressants, because I have a few questions on the same. Sticking on psychotherapy, can you say that depression can end without using antidepressants? Let's say you just focus on psychotherapy alone.
Well, it can, but what is important is all about the severity of depression, the level of depression. Yeah, there are those depressions, like Dr. just mentioned it. There are those people that now they trade in that overgeneralization of things. I have to do this, and if it fails, then I'm a failure. They resort to they suffer low self-esteem as a result of giving themselves the must and the shoulds at the end of the day. So there's that level of depression that psychotherapy can work, and there's that level of depression that one must be actually seen by a psychiatrist. So I can't take it I can't take it that I have to handle a depressant actually, or a depressed client without actually him being screened by a psychiatrist. So it actually a psychiatrist usually
You work hand in hand.
yeah, absolutely. So a psychiatrist is actually the person who should actually give a go ahead, a way forward. This patient need A, B, C, D. Where now we are going to project into the CBT, a lot of therapeutic community activities that will help him understand the underlying issues. But it goes back to the psychiatrist.
Okay.
Yeah.
Dr. Mutisia, we should be going for a short break, but I have a question here. Why are psychiatrists so quick to prescribe antidepressants? As you're thinking about that, let's take a short break. But remember, you're still the conversation is still going on. 22316 is our SMS line, official SMS line. WhatsApp is 0786 316 316. And also after the break, as we hear more from you, what role does alcohol play in all this? Stay tuned. We'll be right back.
Stress is inevitable. It walks in and out of our lives on a regular basis, and it can easily walk all over us unless we take action. Here are some tips for handling stress. Exercising regularly is one of the best ways to relax your body and mind. This will improve your mood. Do it more often for it to pay off. Do something every day that makes you feel good, and it will help relieve your stress. Relaxing hobbies include reading, knitting, watching a movie, doing puzzles, playing cards and board games, among others. Eating a regular, well-balanced diet will help control your moods. Your meals should be full of vegetables, fruits, whole grains, and lean proteins. If you have stress, talking about it may help you feel better. You can talk to family members, friends, a trusted clergyman, your doctor, or a therapist. Figure out what triggers your stress. If you're able to identify what it is, see if you're able to eliminate it or at least reduce it.
Thank you so much for staying tuned to Doctors on Call, coming to you live on Family TV and Family Radio. Still here with me is Peter Clinton, a psychologist, together with psychiatrist Dr. Catherine Mutisia, and we're talking about depression. I'm still receiving questions from you on 22316, and I'm also receiving some on our WhatsApp number 0786 316 316. Now, before the break, there was a question that came in on WhatsApp asking why psychiatrists are so quick to prescribe antidepressants. Maybe as you respond to this, we can get to understand a bit on the role these antidepressants play when you are talking about depression, Dr. Mutisia.
Actually, depending on the severity of the depression, mild form of depression can be managed by talk therapy, by helping the client understand the various stresses in their life and how to handle them, and to actually understand why they need to constantly stop to listen to their body. When they are tired, they need to rest, they need exercise, they need to eat well. So basically, mild cases, you will not need antidepressants. And again, as we were discussing over the break, it is your right as a client or as a patient, when you're seeing any doctor, not just a psychiatrist, to understand why the various options of treatment for your disease, and why a particular option is better than the other, and or why you need a combination of therapies. So basically, we will not prescribe, personally I will not prescribe drugs if somebody doesn't need them, but there are various things, like for example, lacking sleep, and it has been ongoing for 2 weeks. Surely you would not expect that talk therapy one session would sort that out without a bit of assistance. When we have suicidal thoughts, we are not going to sit and watch. We need to make the patient recover as fast as possible. And in cases where the person is not eating, not talking, not be able to move on with their life. So it's not right to prescribe drugs when the person doesn't need them, but there are cases where the person needs them. What is important is for the patient to understand the various options and why they need medication and why they can't do without them. Yes.
Antidepressants, what
Yes.
role do they play? Why are they important? Yeah.
We know that depression, there is a biochemical imbalance where you find the feel-good hormones, serotonin, adrenaline, norepinephrine are low, and we need to boost them up by chemicals, which in our case would be antidepressants. And when we prescribe drugs, we look at the symptoms you're presenting with. For example, somebody who is having excessive sleep, we would give them antidepressants, which would stimulate them, and they're taken in the morning. Somebody who is lacking sleep, you give them antidepressants, which will be able to sedate them and give sleep, and usually given at night. Yes. So basically, they boost the serotonin and norepinephrine hormones in the system, which help you feel good.
All right.
Yes.
Thank you so much for that. And on Facebook, I see Judith Hilda Otieno is saying she's getting us loud and clear in Komarok. Thank you so much, Judith, for tuning on to the show. And I have questions here coming out from different places in the country. For instance, there is Janet from Athi River. Peter, maybe you can assist Janet with this. Please advise. I'm getting into depression. I like and enjoy being alone most of the time. I don't socialize. I'm 50 years old and I live alone. Well, if you could ask me, I'd say this person is simply an introvert. But you being the medical practitioner here, will you say that this is enough to say that this patient has depression? And also, you know, there's a thin line between being an introvert and somebody who has depression, Peter. Putting you on the spot.
Absolutely.
Yeah.
There's this part of melancholic. The what melancholic. Yes.
Yeah.
What is important here is that there are two features. Yeah. There are two features that can actually. There are two plus others that can actually make somebody be diagnosed with depression. He has just talked about losing interest with ABCD. Maybe there's that bit of it that she has talked about, and then she doesn't like talking to people and other things. So losing interest, that anhedonia that we talked about, and Dr. also mentioned it. So those are the key things that can actually make somebody to be diagnosed with depression at the end of the day. Yeah. So there are key things that she has actually mentioned that a psychiatrist can be able to diagnose him with depression at the end of the day.
All right.
And also maybe to add on to that,
Yeah.
sometimes depression can coexist with anxiety. Because again, if this person is avoiding contact, is it more of social anxiety as well? And is it affecting your work? Is it affecting your relations? Because if you isolate yourself to the point where you really want to relate with people, but you avoid to do it and it affects you, then you actually need treatment. So sometimes it could be a mixture of anxiety, or anxiety alone, or anxiety together with depression.
All right.
Yeah, and actually the key thing that just to echo what Dr. has just talked about. What is important again here is all about that when as you if she assumes those things that she has actually mentioned, then at one time it actually may grow, and then she will now find herself that she doesn't even want to access going out, just locking herself in a room. So that is what is important. Screening is the best, but those are already symptoms that can at the end of the day lead to depression.
All right.
Yep.
Doc, just to take you back a bit, earlier on you were talking about treatment options, and Peter mentioned on psychotherapy, you also mentioned on antidepressants. Are there any other forms apart from these two? And also, maybe as you respond to that, you can also answer Margaret Nyabola.